Hello, everyone. My name is Aisha Langford, and I'm the founder of Funeral Syllabus, where the motto is make a plan, keep the peace, leave a legacy. Today, I'll be talking with Dr. Tara Liberman, who specializes in geriatric and palliative medicine. She practices medicine in New York, and her work is dedicated to caring and promoting academic efforts within an aging and vulnerable population. So, thank you for joining me today, Dr. Liberman. So,
Thank
we'll
you.
we'll go ahead and jump right into the questions. So, can you tell us a little about your journey into medicine and what motivated you to become a geriatrician?
I took a path that was a little bit different than most. I was really loved as a high school student. I worked for a pharmacy as a pharmacy tech. And so when I would go and check somebody out, a lot of them happened to be elderly customers. And I would spend a quality of time with them trying to explain to them what medications they had, how they were supposed to use it, and when to come back if they had any questions. And at that point, I started to realize there was this vulnerable population that people were just they had a lot to give to me. They taught me a lot of interesting things, but I also could give to them as well. And so when I went through my, college, I continued to work in the pharmacy. I worked through it all through college. And then I went into medical school and I was just drawn to the aging population because I realized that they were vulnerable and people always wanted to just treat them like every other patient population out there. And I recognized they had different needs and different support systems that were not traditional provided in the regular day-to-day cases of our patients. So I did my internal medicine residency and I jumped right into our geriatric fellowship. And it was exactly where I wanted to be. I knew this was the population that I wanted to serve. I wanted to make sure that their voices were heard and that they were being able to be cared for and live longer and more healthy. And people were not just discriminating against them because they were of an older generation and had less quote unquote worth. And this is why I've been so passionate about this work and have been so fulfilled. People have given back to me in so many ways, and I'm so grateful to give back to this group. They're so amazing and have so many interesting things to teach us. So that's why I'm always inspired.
Okay, great. And some people are not familiar with the concept of a geriatrician. So, how are geriatricians different and maybe similar to other type of doctors, like primary care doctors?
Yeah, so most geriatricians have either trained in family medicine or internal medicine, and then they specialize, which is an extra maybe year or two of training in geriatrics. And so most people have the background of just as we call primary care. And this is just the ability to sort of specialize on patients who are either aging in timeline, meaning that they're over 65, and or patients that have a functionality that may be coexist with that sort of aging number, right? So you could still be a 50-something-year-old with dementia, and they would have similar needs and concerns that a patient of 85 and their family may need as well. So I don't always say geriatrics is about a time, it's more about a functionality. But I always encourage people when they get to be older to sort of identify somebody who can sort of look at them a little bit differently, the way they take their medications, the way they're mobile, what things that's important to them, just so that they are attuned to the things that occur when you get older. I always think of it as like a pediatrician. You have a specialty in pediatrics, right? Their bodies are a little different. The way they get medications are a little different. The way they look at the world is a little different. The support around them is a little different. Same thing as you get older, especially as you get frailer. Those things also occur. And so it's sort of a way of thinking about how to care for somebody as they age.
Okay. And over the last decade or so, there's been growing concern about this term elder orphans. So, what are elder orphans and what are some of the key challenges for this group?
Yeah, so in the past, most people in society lived together, right? As you grow older, you took on your grandparents, and they supported them until they passed away. As society has changed, there's a lot of people who are moving away from their parents, right? The joke is in New York, all kids live in California. And so we always are listening at these families or these elderly people who are by themselves. Also, a lot of people tended not to have children in this generation. So a lot of people are without any kids. Their spouses may have passed away or they never got married at all. And then there's also the idea of being an eldered orphan just because you may have had your whole family and then they've also passed away or they're not around anymore. And that's because we're living longer and having longer longevity. It's not uncommon to see a 102-year-old whose spouse has passed away, and then their children have also passed away. So they're by themselves, and they don't, in the sense of a world, have a support system within their community.
Okay. And what are some of the common health concerns for elder orphans and how can they proactively manage them, I guess, if they're healthy enough?
Yeah, so what I would say is, in the aging, age-friendly health system, we're really focusing on what we call the 4 M's, and that's mindfulness, making sure that we identify how their memory is and making sure that they keep up to date in medical care to keep their mind and their as keen as possible. What medications they're taking, making sure that they understand that they're taking the right medications at the right time. They might have taken something when they were younger, and now as they've gotten older, body has changed, and maybe this isn't the right medication for them anymore. um, how they're mobile, like making sure that they're able to get around. What we see, especially in this elder orphan population, is isolation. People start to not be able to drive as well. There's less ability to take public transportation because of their functionality needs. So identifying the needs of their mobility. And then the last part is what matters most, making sure people understand that they have a wish and a desire, and what matters to them may not be what matters to somebody else. And so being able to voice those concerns to their providers and to their community so that people, if they're unable to make those decisions on their own, someone will make them for them.
Okay. And that's a great lead into my next question is really about how can an elder orphan ensure continuity of care if they don't have a designated caregiver?
So it's very important to find a provider that they are entrusted to. And so that they can be able to go through these important 4 M's with them. And so that can be difficult in some parts of the country where primary care is not as easily accessible. But I encourage all eldered orphans or elderly or aging patient populations to find that one provider that really understands these things. And it may not be a primary care doctor, it may be a cardiologist, it might be a gastroenterologist, but somebody that they feel that they have really connected to and they can sort of review these things with. It's very important to have that healthcare provider that's connected. And I see more often than not, because they are unable to, um, they go from doctor to doctor, that they haven't found the one person who really owns their medical care. So in sight, they should tell them that you are going to be owning my medical care. I think empowering our patients to tell this to their provider is really important. And if they don't feel comfortable, to recommend them somebody who can.
Okay. And we've also been hearing in the news a lot about loneliness and social isolation. So, how can elder orphans combat loneliness and social isolation and I guess maybe build community?
Yeah, so I mean, I guess with COVID, we've sort of ended up back in our homes and not reaching out to the community. I think now with the 5 years gone, I think it's time to rethink about this. Find those churches, synagogues, mosques, places in your community that, you may have gone to in the past, but really would find a connection to now. A faith-based program is really a great place to find people who are similar in mind and also have a lot of support. There's also community centers, lots of like YMCAs and JCCs in the areas that have lots of activities. Libraries, I find the libraries are a really good resource for our aging population to find communities that are doing like-minded things, speakers, movies, courses. And usually all of these things are at a very reasonable price because of, obviously we want to make sure that their income could be limited and they have the ability to be getting to the community. And then the last thing, which I think is not a bad thing, what we learned in COVID, is there are a lot of things online. And I like to say that our aging population isn't technically not savvy. They're actually pretty good. And I think COVID pushed them a little bit further. So they have that opportunity to connect with people through Zoom and, Teams and any of these great opportunities to sort of communicate through telemedicine, telepsych, and then for other, just fun activities. I know people do exercise through it. A lot of the managed Medicares provide a link for exercise in your home if you can't get out. So there's a lot of things that technology can also offer that I encourage people to sort of lean into so they can connect to their community.
Okay. And now I wanted to move to legal documents. So, what legal documents should elder orphans have in place or at least consider putting in place? So, I've heard things like advanced healthcare directives, power of attorney, living wills. There are all these type of terms out there, and it can be confusing. So, are there certain legal documents that you think are a priority for elder orphans to have in place?
So the most priority for me as a healthcare provider and for a person who's aging and wants to make sure that their wishes are known would be a healthcare proxy. I think that's an easy document, and you can do that with your physician in their office or your NP or PA. It really is just a state document that just designates somebody if you would not be able to speak for yourself. And then if that person isn't available, to have a secondary. I always strongly say only 2. Please don't go into like 20 people because it gets very confusing. But then having the conversation after you've designated that person or those people about what is important to you, what is important if and when you can't speak for yourself. This is not something that needs to be done with a lawyer. It does not need to be so we're looking for
A notary?
a notary. Thank you.
Okay.
It's just all it needs to be is witnessed by 2 people, and that's it. So a healthcare proxy is the most important thing to make sure that your medical healthcare wishes are known. A power of attorney is for your finances. And that's really also an important document as well. And that also designates somebody who you want to oversee for your finances. A living will sort of tells your healthcare proxy guidelines. It's not a legal document. It only just is a guideline for that healthcare proxy. So it's not necessary. But I know that there will be a lot of lawyers out there that will insist that you fill that out. It is helpful for some, especially if you have specific things you want to say in it. But the majority of living wills are very, like I'd say, boilerplate and just all say the same thing. So if you just have that conversation with your healthcare proxy, that's probably more pertinent than a living will.
Okay.
Yeah. So those are those things that are important.
So sometimes older adults, the default will be children or like a sister or niece or nephew. So if elder orphans don't have immediate family member or friends in place, can they ask their doctor to serve in this role? Or like what would be backups if they don't feel like they have immediate family members or friends who really know them that are able or willing to serve in that role?
Yeah, so I mean, I think that what happens in most states is that there's a a hierarchy if you don't fill out a healthcare proxy. Each state varies from state to state, but there is a hierarchy. And even a friend or a colleague that they have known usually can be somebody who can make decisions if there's no other family. However, my suggestion is if you don't have anybody in this world that you feel comfortable with, you can have this conversation with your provider, and you can tell them what's important to them, important to you, and you can actually designate them as your healthcare proxy. They would have to not be caring for you at the time that they have to be making decisions, but at least you know there's somebody out there that knows your wishes. So that's a last resort, but something that can be done, and I have seen done successfully, for patients who really want to make sure that their wishes are known and they really truly have nobody.
Okay. And as we get older, we may or may not need assistance like long term care needs. So I'm wondering, what are some ways that elder orphans can begin thinking about and planning for long term care needs if they don't have family assistance or an immediate social circle?
So there are a lot of long-term care programs out there, and you can inquire about getting an insurance benefit called a long-term care benefit, and that is usually a payment yearly for the ability to at any time have the need or like someone to care for you in your home, to be able to actually use this benefit to have them be brought in through the insurance benefit to care for them, like cooking, cleaning, dressing, bathing, things of that sort. A lot of times these are expensive. And so there's also the opportunity to sort of talk about Medicaid if they're financially able to, and they qualify for it. A lot of people don't like to look towards Medicaid, but in circumstances, it's really helpful in the community to get that benefit so that you can have somebody come in and help clean or cook or get your help dress or bathe. And so I know that some patient populations feel like ashamed to apply for those things, but I know as we get older, finances are really hard. And so if you couldn't afford a long-term care, there is that opportunity as well. I also always encourage that community resources. A lot of people in the community know people who would like to help support people and can help at a lower cost. So it's all about that reach. And so that's why I always encourage if you're an elder orphan to sort of do that sooner than later so you're not by yourself in when something is in crisis.
Okay. And just talking about aging in general and healthy aging, so to speak, what are some preventative health screenings and vaccinations older adults should prioritize?
Yeah, so I think it's important to meet with your provider yearly, and to make sure that you're up to date in the things that are needed at your age appropriateness, right? So as we get older, we want to make sure that we're getting a flu vaccine every year. Really important so that, the flu is unfortunately, as we see people die from the flu, especially as we get older. It's also really to be up to date on your pneumo vaccine, and making sure that that helps with pneumonia. We are seeing a rising in RSV, and that's because as you get older, that immunity wanes. So that's something that we also look for people to have. And then also to talk with your provider about COVID vaccines to see if it's appropriate for that time or that the area that you're in. It's also really important to keep up to date in making sure that you have your cholesterol checked, your blood pressure checked. Those are really important things as well for heart healthiness. We want to, as women age, especially women, they have more risk of having a heart condition, and so we want to make sure not to forget about our aging elderly women. Bone density as well, making sure that we don't want to have osteoporosis. It's a very important thing that can cause, pain and suffering later on in life. And, also just making sure that, we'd like to not smoke, right? And drinking in moderation. So these are all the important things that I always encourage healthy aging um, to continue with your ongoing yearly evaluations.
Okay. And I've also been reading a lot just about brain health and reducing risk of things like Alzheimer's. So, how can older adults help maintain their cognitive health and reduce the risk of getting dementia?
So all we have found is if you don't use it, then you'll lose it. So really important to keep your mind active. And I also think reading, education, engagement with others. Also, physical activity helps, and eating well, a well balanced diet is really important as well. We see patients who have high blood pressure and high sugars can be an increased risk in memory loss. So just keeping a healthy diet, healthy exercise, and to continue to use it, don't lose it. That's always my sort of set statement to all my patients. Engage as much as you can. We know that those who continue to use their brain tend to lose the memory less.
Okay. And when you say use your brain, are you talking about crossword puzzles or really just being socially active
Oh,
or talk like what kind of counts as using your brain?
all just being active, being
Okay.
isolated and alone and not really using your brain is really detrimental. So what we see is if people are reading, if they're engaging with others, if they're doing things like crossword puzzles or they're taking courses or always trying to learn, it sort of helps the brain function. It's like a muscle, right? If you stop using your muscles, they start to wither, right? So if you stop using your brain, it will wither as well. So the more you use it, the better it is.
Okay, great. And in closing, are there any other tips or considerations you'd like to leave us with as we think about elder orphans or healthy aging or staying socially active?
Um, I would just say that aging is just a number, and everyone should continue to, be healthy, be positive, engage, be your advocate. Make sure that you have the resources for yourself in times of crisis because you don't want to be in crisis without any support. And so thinking about this ahead of time, especially those who are elder orphans, is really important in preparing for the future.
Okay, great. Well, thank you for spending your time and expertise with us today. And it's been great chatting with you. And I appreciate you taking some time to share some tips with us.
Thank you. This was great.